Welcome to the Franklin Method Fellowship. I'm your co-host Solange Ross, and I'm joined by my colleague Deborah Chassie. We are physical therapists specializing in the pelvic floor. In this podcast, we share our passion for the Franklin Method, an evidence-based therapeutic approach using mental imagery, movement, and awareness to improve posture, the way you move and feel, and overall well-being. We integrate the Franklin Method into functional everyday movements, all forms of exercise, and our physical therapy practices. We also share a love for talking about the pelvic floor. We hope to inspire you to move better and feel better in your body. Always check with your doctor before beginning an exercise program. This podcast is not intended to be used as medical advice. Let's grab your Franklin Method balls and bands. Enjoy the show. Welcome to the Franklin Method Fellowship. My name is Solange Ross, and I'm joined by my colleague, Deborah Chassie. And we are in episode 17. And this episode is on healing post-abdominal surgery. So many of us know people who have had abdominal surgeries. Maybe you had a surgery during childbirth. Maybe you had some sort of procedure done. Maybe you know a friend or family member. And we thought with this episode, we would give you some tools to, especially early on when your incision is healing, so that you can feel more comfortable. And we're going to give you a whole body approach to healing. Let's begin with a check-in. So we're going to just notice and feel our abdominal wall. And you can notice your breathing. You can notice levels of tension. You can notice posture. You can notice anything in and around the pelvis, in and around the rib cage. So we'll check in 3, 2, 1, and go. And welcome back. How was your check-in?
It was great. It took me by surprise a little bit. So at first I was noticing my breathing, but then I became aware of my feet touching the ground. So grounding for my feet. And then the next one was grounding on my sit bones, grounding into the chair, and noticing there was some unevenness, especially in my sit bones, but just being aware of that. And I'm looking forward to seeing what we do next and how it's going to change.
And I love the way that you mentioned your feet and just the foundation in the pelvis, because with the work that we're going to do next, I want everyone to sort of think about their feet and think about the positioning of the pelvis as we begin to do some work to connect to the abdomen, because that is our foundation, how we're sitting. So let's begin, and we're just going to use light touch on our abdomen. So you'll place your hands on your abdominals. And so if you have a scar, you may have a vertical scar on the abdomen. Maybe you have a horizontal scar, like a C-section scar. Maybe you have some incisions around the belly button. Wherever the scar is, you're going to place your hands on either side. So if it's vertical, they're to the right and left of it. If it's horizontal, they're going to be above or below. And we're going to begin with just some light touch, stroking the abdomen. And with this touch, we're trying to just connect and let the way our body feels our touch guide the way we're using our hands. So we're not forcing, we're just introducing movement above and below or to the left or right of where the incision may be.
And I like what you said about letting our hands guide the movement, because our bodies know what to do and our hands know where to go. So we just let them guide us.
I love that. And we always want to remember that, especially when we have an injury or healing from a surgery, that our bodies are always working for us, even if it doesn't feel like they are, even if we may be experiencing pain or we're healing. So your hands know what they need to do.
And really what we're doing here is we're bringing the tissues in together. This reminds me, we had a friend visiting and she cut her finger at our house and it was deep enough that it was going to need stitches. So we went to the emergency room. While we're sitting in the emergency room, I'm approximating, that's a physical therapy term, but bringing the seams of the cut together. So that way, so along the vertical line, just like what we're doing right here, I was just bringing that in together and gently holding it, no pressure. And basically it helped accelerate the healing process.
Absolutely. And so if we have a horizontal scar, we can place the hand above and below. And then we can bring the hands together. And as you're bringing the hands together, you want to just send your loving kindness to your body with your
Featuring
healing
a lot
hands.
of hearts, healing hearts.
And then we can just let the hands relax down by our sides.
Nice to feel my breath. And to feel my pelvis just sinking into the chair, my sit bones. My feet grounded.
Ooh.
And my head supported. I'm getting it from all ends. Looking at a whole body approach, one thing that we want to consider is the lymphatic system. So in the lymphatic system, what we want is waste products to go to our lymph nodes. So if we do circles where the lymph nodes are located here and under the arms, they're located in other places as well. But by doing circular, very slow circular movements around those lymph nodes will actually help what's there, the waste products that are there, to empty out and then be able to receive more. And that's the goal, is to get the waste products from the surgical regions to go to where the lymph nodes are at, to be phagocytized, is the word, eaten up. So let's just place our hand between our collarbone and the base of our neck. And you're just going to be immediately below the skin, and below the skin is the fascia. So we're going to be on the fascia, not on muscle. There's muscle below the fascia. So what you're going to do is just move your fingers. So you're not deep like that, but flat fingers. And then just moving in slow circles. And each circle should take about 4 seconds. And it doesn't matter direction. So the direction could be this way, clockwise or counterclockwise. So 4 seconds would be 1, 2, 3, 4. So just kind of picture maybe an elliptical shape where it's a little bit more oval, or you could picture a circle itself. So this gets the lymph nodes stimulated to empty out to receive more. Nice and slow. So you could actually, the first time you do this, you could do 30 of them easily. But if that's too long, then at least start with 10. And then as you do it more frequently, you don't need to do it as much. In other words, you may not need to keep doing it for 30 times. You might just need to do 10. Right? I think that's good. So now we're going to do the other side because we have lymph nodes on both sides. So again, very light touch with the length of your fingers. And it's 1, 2, 3, 4. 4-second circles, moving the skin over the fascia. And just kind of notice how calming that is. It stimulates the parasympathetic nervous system, and then that relaxes the entire body. So if you're having pain, then wouldn't it be nice to be able to do something real simple far away from your thought to help reduce the pain? And just notice your breathing. Let your breathing be relaxed and posture to be relaxed. And you see Solange is moving her neck a little bit. You can move your neck. That'll move the fascia around the lymph nodes.
One thing I'm noticing as I'm doing the circles is that my nasal passages have opened up. So it's really helping my breathing.
Right, right. Well,
That's
and you're
great.
right by below the collarbone a little bit. So that's where the pec minor muscle is. And when you do some gentle massages on that pec minor muscle, like little circles, it will actually help to open up the sinuses. So that's better for your breathing, right?
Yeah.
Yeah. Okay. Yeah, and just drop your hands. Notice how your posture feels. We're going to do a little bit more. So I think before we do bigger comparisons, let's go to the armpit. So you're just going to lift your arm. You can bring it up if it's comfortable, but if not, then just hold it in a comfortable position. And you're going to do the same thing where you're moving your skin over the fascia, which is covering the lymph nodes. So 4-second circles. 1, 2, 3, 4. Yeah.
And if this is uncomfortable, is it good for someone to be here with the arm by the side, or would that work?
Or they could even lean forward a little bit, right? So if they're just flex forward, they can still get under their arm. And you could sit up straight if that's more comfortable and just be in the periaxillary region. Because even as you pull here, you're going to be giving a little bit of a stretch. Yeah. Yeah, that feels really good.
Yeah.
And then the other side. So some people like their arm above, and some people prefer their arm forward, maybe leaning forward. And some people prefer to sit up. All right, so notice that thumbs up. That's because the computer sees my thumb is up. Anyway, we're just going to go with it. I'm going to tuck my thumb in. So if that doesn't feel comfortable for you, please just have your thumb relaxed. And then you'll get a thumbs up signal.
I'm okay with it. I think it's a sign that, you all are loving the exercise that we're doing and that you want to do more and more. So it's
Right,
all
right.
good.
Yeah. So just notice your breathing. Relax your breathing. Yeah. There we go. Oh, I feel like I can take a deeper breath. What do you notice, Solange?
Yeah, I can feel like my shoulder girdle is nice and relaxed. And when I took an inhale, I could really feel a lot of space in both armpits, which felt really
Mm,
nice.
yeah, I'm really feeling the breath in my chest.
Yeah.
Just a nice opening. And that's going to stimulate lymph flow, by the way, is good breathing techniques will increase the lymph flow to the lymph nodes.
So let's take a
Yeah.
look at the abdominal organ. So Deborah, if you want to pull out your model and let's map out what's inside so we all have a better image.
All right. So here we have the anatomical model. Here are the lungs. So the nice thing is I can actually remove them, and I pretty much need to remove them so that I can remove the other ones. And then here's the heart. Now I can remove the liver and the stomach. You just notice here's the diaphragm above the liver, and maybe trace that just like Solange is doing. And as a matter of fact, you could even just trace around the liver and around the stomach. I like the way that feels. And I'm going to remove that. And below that, you have the transverse colon, and the pancreas is behind. And then here's the ascending colon. I'm going to take this off so you can see. And the descending colon. Basically, the colon moves like this. And when I take this off, here, so I'm going to take this out. So here is the transverse colon, and above that is the pancreas. And you can see the pancreas on the backside as well. And another important structure is this is the duodenum. It's the beginning of the small intestines. And if I turn this around, you can see how it comes behind. It actually goes pretty deep. And then you have the jejunum, which is all of the squigglies for the small intestines. The upper part of the small intestines is the jejunum, where the lower part is the ileum. And that then joins over to the right side, which is on me, would be like right over here, where it joins into the large intestine. So the large intestines, you have the ascending colon, the transverse colon, and the descending colon going into the sigmoid colon and the rectum. So let's go ahead and trace that. So I want you to feel your jejunum and your ileum. There's just little, maybe some little circles around it. There you go. So it goes into the large intestine, the ascending colon, over to the transverse, and then back down to the descending colon. And look at that. You go into the sigmoid colon and then into the rectum. Here we have the jejunum. So if we just gently touch our belly where the jejunum would be, the small intestine, and then it goes into the ileum. And from there, it empties into the right side and goes into the ascending colon, to the transverse colon, and then down to the descending colon, to the sigmoid, and then to the rectum to eliminate. So here we go again. Ascending colon, transverse colon, descending colon, sigmoid, rectum. And I like to do this with my hands because I'm just imagining that's the elimination process. So one more time. Ascending colon, transverse colon, and descending colon. Sigmoid, rectum. And then just stop and notice. What are you noticing, Solange?
Just feel some nice movement in my abdominal wall, which feels good.
Mm-hmm.
And good support in my feet on the floor. That feels
Mm,
good.
nice. Yeah. I'm just noticing a lot of expansion in my chest for breathing.
Good.
Mm-hmm. That's going to help the lymphatics and healing of the scar and motility for the organs.
So if you have your balls, let's take your balls. If not, you can just use your hands and imagine that you have balls. And our balls are going to be our ascending and our descending colon. And we're going to imagine them as pillars. And when we bend our knees, we're going to imagine these pillars compressing. And you can give your balls a little bit of a squeeze. And then when we stretch our legs, them lengthening. So bending the knees, give the balls a squish. The pillars will compress. Stretch your legs and they'll lengthen. Compressing and lengthening. Compressing and lengthening. And if you want to put your balls down for a moment and just even placing your hands on either side, when you bend down, you can even feel a little bit of that compression with your hands. And then as you stretch your legs, feel that lengthening, compressing and lengthening. And we're going to take this idea of when we bend the compression and when we stretch the lengthening into taking a step, because that's something that we do all the time with walking, with movement. So when we take a step forward, I'm going to step forward with my right leg. We get that squish on the right side, and then the left side lengthens. And when we step forward with the left, we get that squish on the left side, and the right side lengthens. So I'm going to show that by the compression being the ball sliding up on the right and sliding down on the left. And then when I step with the left, I'm going to slide it up on the left and down on the right. So let's just alternate that a few times. The compression on one side, the stretch on the other.
You know, one thing that people complain about too with post-surgical is the pain medication causing constipation. And I just feel that this would be so good for helping with elimination.
Absolutely. And if you think about all the times you get up and down, and as you're walking around, if all of that is like a colon massage and a colon
Mm,
stretch, that's
nice.
certainly going to help get things moving.
Uh-huh.
So let's just notice and feel.
I feel lighter.
And maybe you can sense some sensation in life in the lower part of your abdominals. Maybe you feel that lightness that Deborah feels, some
My
ease in
feet
your
feel very
breathing.
grounded.
All right, so we're going to transition back into sitting and continue with breathing. So come to a comfortable seated position, and we're going to find our sit bones. So maybe give a rock forward and back. So you find your sit bones. Feel your feet on the floor. Feel your head at the top of your spine. So you're in a nice, comfortable seated posture. And we're going to feel where our colon, those pillars that we were imagining, attaches on our rib cage. So they attach to our lower ribs. So if you feel the angle of your rib cage and then just come around the sides, that's where they attach. And be gentle as you feel around. You may feel some soreness around the ribs. And then with your hands here, we're just going to take a breath in and we're going to feel the movement of the ribs moving into our fingers. So let's take another breath in and sense that movement. So our ascending and descending colon, those pillars, they attach to the ribs. So as we can sense those ribs moving out to the side, we can also try to sense the top of those pillars widening. So take another breath in and see if you can sense that widening.
I can feel my colon pushing into my fingers.
Nice. So when we breathe in, we know our diaphragm moves down. And when our diaphragm moves down, all our abdominal organs are going to get a little bit of a squish. So when we breathe in, keep your hands on your sides. We'll imagine these pillars getting squished when we breathe in and getting stretched when we breathe out. And we can also model that with our hands. And Debbie's got that soft spring, breathing in, getting squished, and breathing out, getting stretched. Breathing in, breathing out. Breathing in, breathing out, getting stretched. One more time. Squished and stretched. So we're going to imagine our transverse colon as this garland. And Deborah's got her beautiful scarf there. And when we take a breath in, that garland is going to roll up and stretch. And when we breathe out, it's going to relax back down. The garland's going to roll up and stretch. And relax back down. And maybe for this one, you just keep your hands on your abdomen and watch the image and see if you can sense and feel that in your body. Breathing in. Breathing out. One more time. Breathing in. Breathing out. And maybe you can even sense how the movement of the garland affects the movement on the sides of the pillars. And let's come to a comfortable position after that and just notice.
It feels really easy to just hold my posture up. Good, strong sitting posture. Look at that. Isn't that nice? It feels
Yeah.
really good.
And I
Yeah.
think that's so important because a lot of us think that we need to have our strong abdominals or our core that's going to support us, right? And
Mm-hmm.
as your core is healing from the incision, we're having the support from our colon that's giving us this nice, effortless sitting posture.
I really feel that in my colon. It feels like my colon is pointing right into my sit bones. Then it's supporting me. Feet are nice and grounded.
We've
Neck
got
feels long.
nice. We've got one more exercise for you guys. So we're going to do a little bit of moving our pelvis. So we're going to just rock side to side on our sit bones. And as you rock on the sit bones, just notice how if you just look at the abdominal area, how when you rock side to side, how that influences the movement in the abdomen. So here we're using our pelvis rocking side to side to give us a nice abdominal mobilization. And then we're going to take this into a circle, like we're just going to be stirring the pot. And move at a pace that feels comfortable to you. You can keep it really small and really slow. Or if you want to go a little bit faster, a little bit bigger, that's entirely up to you. If you want to use your arm to stir and help you steer your pelvis, that'll work too. And
And we probably
really,
want to go in the other direction too, right?
I did go in the opposite direction, but yeah, if you haven't gone in the opposite direction, please go in the opposite direction.
Reminds me of the hula hoop.
And if you like that for an image that you're sitting and doing a hula hoop, you can use that. If you like that you're stirring, maybe you can think about just ripples in your pelvis or that you're moving your pelvis through water or whatever gives you a sensation of ease in your body. And then we'll come back to the center.
Let's take our hands. This is our last exercise. And what I want you to do is just rub them together. And what you're doing is you're creating energy between your hands. And now take your hands and just put it on your scar. And all you're doing is you're just holding, gently holding. And you're allowing the energy that you just created in your hands to go into your scar and to resonate with that energy level for healing. Your body does its own healing. And then you could do it again and bring it lower. In part two, we're going to talk more specifically about scar tissue mobilization. But right now, this episode is on the beginning part, the very early stages of abdominal surgery, and what types of gentle healing that you can do with your own body. So go ahead and take your hands and rub them one more time. And if you don't feel comfortable placing your hands on your scar, you can actually keep your hands away from your body, like that. And the energy from your hand will actually permeate into your scar.
I love that, and I can feel that. Mm. And we send the loving energy from our hands into your scar as well to stimulate healing in your journey and a good recovery.
Yes, happy healing, peaceful healing.
Yeah.
Gentle, loving, kind. Be kind to yourself and love your body. We hope that you've enjoyed this episode, and we want to really thank you for joining in with us. We hope that this brings you some helpful tools for your healing process. Solange, you were going to say something.
Absolutely. So thank you all for joining us. We hope you enjoyed the episode. And please, if you're looking for more, we have a patron program where if you sign up, you get a whole series of exercises that go with each episode. So we would love to have your support, and we know that you'll enjoy our patron-only content. So thanks again for joining us. Happy healing, and we'll see you next time. Bye.
Thank you for joining us. We hope you enjoyed the episode. Please like and subscribe to our YouTube channel, and we would greatly appreciate it if you would leave us a review. You can also become a patron of the podcast. Join our patron program to get access to movement practices from each episode, bonus episodes, and Q&As where we answer any questions you have about the practices. We look forward to practicing with you and continuing to share our passion. As we say in the Franklin method, better information leads to better navigation. Keep practicing, and we'll see you next time.